So I chose to focus on women in the southeastern United States for this project, which includes women from Texas, Arkansas, Louisiana, Mississippi, Alabama, Georgia, Florida, Tennessee, Kentucky, South Carolina, North Carolina, Virginia, and West Virginia. This population in the United States makes up 53 million women just in the southeastern part of the United States, but women overall in the US in 2010 was just under 160 million. So this population in the southeast makes up 33.6% of the overall population and about 17.1% of total people in the United States. This is a diverse and growing population, and that's also one of the main reasons I chose to focus on them. So as I mentioned, this is such a large population, with the four most popular states being Texas, Florida, Georgia, and North Carolina, which contributes to why the southeastern part of the United States makes up such a large portion of the overall population. This community is also known to be not the most educated and not have the best health care. And in America, overall, 88% of whites and 79% of blacks in the southeast have health care, yet many of these people that do not have health care are often living in rural areas. This population is also very diverse, varying across a number of different factors, including citizenship status, age, urban-rural composition, socioeconomic status, and income. This group of people is growing rapidly due to domestic and international migration and is not expected to decrease anytime in the coming years. The South faces many disparities, including health coverage, health status, and healthcare relative to the rest of the United States, and Southerners are also more likely to be uninsured, less likely to have access to needed healthcare services, and more likely to experience a variety of different chronic health conditions, including diabetes and heart disease. I'm also a member of this demographic since I am a woman living in the South, yet I have never actually researched anything about it. Some of the health issues that are facing this population can be defined by comparing the health and well-being of these people that are in this population. So states where women's health is worse in the southeastern part of the US include Arkansas, Mississippi, and Alabama. And none of these states in the southeast are in the top 1/3 for health and well-being nationally, and this population desperately needs attention. So many issues face this population, including reproductive health, STDs, HIV and AIDS, sex education misinformation, lung cancer and disease, Alzheimer's, heart disease, stroke, irritable bowel syndrome, and ulcers. And this population has the highest regional average of HIV, with almost 50% of new HIV/AIDS diagnoses coming from this region. And it's also projected by 2025 that there will be a 50% increase in Alzheimer's related deaths. This is the worst region for many diseases, such as deaths related to heart disease, stroke, cancer, lung disease, and AIDS, with 12.2% of the population suffering from heart disease or stroke, and the highest rates being in Louisiana, Mississippi, and Tennessee, and the lowest rates in Florida and Virginia. This region also has an area known as the Stroke Belt Buckle, made up of North and South Carolina and Georgia, and these three states have 40% higher rates than the national average for strokes. What people also may not consider is that race impacts vulnerability, and African Americans have higher rates of diabetes, hypertension, and heart disease in the South compared to other groups with leading causes of deaths, such as heart disease, cancer, and stroke. So health disparities are preventable differences in indications of health of different population groups, often defined by race, ethnicity, sex, education, socioeconomic status, and geographic location of an individual, but improvements are possible. So other health disparities include immigration status, employment, and political representation. And for subgroups of women, such as women in the southeastern part of the United States, they face additional disparities caused by disease burden, particularly for women who are socially disadvantaged due to their race, ethnicity, income level, or educational attainment. And socioeconomic status is also another factor because the bottom third of the poverty index score for the South includes Louisiana, Arkansas, Mississippi, and West Virginia. Some of these states do have larger populations as well. There are also low rates of health insurance. For instance, of the states in the Southeast, Texas, Louisiana, Georgia, and Florida have the lowest rates of women with health insurance for the region. Poverty is also a major concern because 22% of the population in the South is below the national poverty level. So that is going to be millions and millions of people that are living in impoverished conditions. Diet, and a poor diet especially, can increase a person's body mass index or BMI, and it has increased in recent decades. That is independent from diet composition, so due to other factors in an individual's life. Their education is also very influential because many women do not finish high school or end their education with a high school diploma. And there's also a lower percent of women receiving a bachelor degrees in the South, which is 27.6% of women compared to a little over 30% nationally. And Virginia and North Carolina have the highest percentage of women graduating with degrees, yet the South is still suffering from these health disparities. Women are faced with additional challenges compared to men, and they're related to differences in risk factor prevalence and control, access and the use of evidence-based treatments, and social or environmental factors. But for this population, cardiovascular disease is a major concern for women in the Southeast, and cardiovascular diseases are groups of disorders of the heart and blood. So cardiovascular diseases include coronary atherosclerosis, ischemic heart disease, myocardial infarction, and stroke. CVD, cardiovascular disease, is also the leading cause of death of women in the United States and the Western world. Some risk factors for this population include obesity, abdominal obesity, hypertension, older age, diabetes, elevated cholesterol, triglycerides, low concentrations of HDL cholesterol, which is the good cholesterol. And CVD also causes 13% of worldwide deaths, with over 700,000 heart attacks annually. So this issue develops because risk accumulates throughout an individual's lifetime, and it can start as early as when a person is in the fetus, and it continues through infancy, childhood, adolescence, and adult life. So you might be wondering, what happens to a person with a health issue? When people have CVD, it can lead to heart valve problems, arrhythmias, heart attacks, and even strokes. And why are the communities particularly affected by it? Women are more vulnerable to this disease for a variety of reasons. And almost 50% of women fail to even recognize that CVD is a major health problem, and so they don't typically partner with healthcare professionals or their primary care providers to develop a heart-healthy lifestyle. They also face higher risk factors, which influences the prevalence of CVD because people, particularly women in the Southeast, have higher obesity levels than elsewhere in the country. 35% of women in the United States are impacted by their heart disease, so it's important to address this issue sooner rather than later. The national mortality rate for women with heart disease is also 136.1 per 100,000, which is higher than anywhere else in the United States. Also, of the 14 states in the South, 9 of them rank in the bottom third nationally for heart disease mortality. So some future trends that can be expected include a decline in overall mortality rates for overall women, but that was from 1999 to 2011. So of course those rates and the mortality for women with CVD is going to change. But the burden of disease and risk factor prevalence does remain high, and women maintain worse outcomes and higher incidences compared to men. And the community will get unhealthier unless this demographic is addressed properly, but long-term changes are required more than just expanding healthcare coverage. Health professionals have addressed that CVD is a major health concern for women in the southeastern US, and so they use different tools to identify which risk factors increases an individual's risk for illness and death. There is significant room for improvement for this population as a whole, but improving the health of this community will not happen overnight or without the support of the nation as a whole. So there are different strategies for improving health for women in the Southeast, but women in the South disproportionately suffer from chronic diseases such as heart disease, cancer, and HIV/AIDS. So these programs need to be culturally customized messages that are heart healthy to promote the elimination of cardiovascular healthcare disparities. A suggestion is also to improve women's health and access to health care services through addressing issues sooner rather than later, because by the time an individual is middle-aged, many people have already accumulated significant risk, but it's not too late to take action. Also, all individuals, insured and uninsured, need to remain connected to care no matter how remote or impoverished they may be. Also, there needs to be an increased investment in prevention and treatment for women in the Southeast. Ongoing provider development is also a key part of improving the health, particularly for CVD for this population. So healthcare providers need to train other providers so they can understand the mental and physical needs of women in the Southeast. And this will also improve the capacity and delivery systems, which is essential for addressing healthcare needs and challenges that may present themselves. Also, it is important to focus on heart health and wellness rather than focusing on heart disease, because when an individual hears that they might be close to developing a heart disease or that they have a heart disease, it can often be scary. Empowering women is one of the most important things that the healthcare system can do to improve this issue, because it is important to personalize and translate knowledge and awareness about heart disease into a heart-healthy lifestyle that people can incorporate into their current life. It is also important to improve personal commitment to health and wellness, which is obviously done on an individual level, but it also includes modifying risk factors as well as customizing diagnostic and treatment approaches for women's physical, mental, and social well-being. There needs to be rigorous life course approaches by starting prevention at birth and continuing it throughout an individual's life. And this can be done by building a diverse foundation of prevention strategies that address age, gender, and regionally sensitive communities. Overall, healthcare for women in the United States, particularly in the Southeast, is a community that needs to be addressed sooner rather than later, but there are major rooms for improvement, and I think that as a nation as a whole, we need to recognize that this community is vulnerable and we need to take actions to try and improve their health, because by improving their health, we will be improving the health status of the United States as a whole.